Heart failure. The best treatment options. There are multiple options for treating heart failure. Regular medications and lifestyle changes coupled with careful monitoring make up the first line of treatment. As the condition progresses, centers specializing in the treatment of heart failure can offer more advanced treatment options, such as surgery. Treat heart failure. Taking your heart failure medications as prescribed is one of the most important things you can do to manage your condition. The more you know about your medications and how they work, the easier it will be for you to stay on track. Common types of drugs used to treat heart failure include aldosterone inhibitors, angiotensin-converting enzyme inhibitors, angiotensin II receptor blockers, angiotensin receptor neprilysin inhibitors, beta blockers, blood vessel dilators, calcium channel blockers, digoxin, diuretics, heart pump medication, potassium or magnesium, selective sinus node inhibitors. Surgical procedures are used to treat heart failure. Surgery is aimed at stopping further damage to the heart and improving the heart's function. Procedures used include bypass surgery. The most common surgery for heart failure is bypass surgery to route blood around a blocked heart artery. Left ventricular assist device, LVAD. The LVAD helps your heart pump blood throughout your body. It allows you to be mobile, sometimes returning home to await a heart transplant. Heart valve surgery. As heart failure progresses, the heart valves that normally help direct the flow of blood through the heart to the rest of the body may no longer completely close, allowing blood to leak backward. The valves can be repaired or replaced. Infarct exclusion surgery, modified D'Order procedure. When a heart attack occurs in the left ventricle, left lower pumping chamber of the heart, a scar forms. The scarred area is thin and can bulge out with each beat. A heart surgeon can remove the dead area of heart tissue or the aneurysm. Heart transplant. A heart transplant is considered when heart failure is so severe that it does not respond to all other therapies. Prevent heart failure from worsening. To prevent your heart failure from worsening, monitor your own symptoms. Check for changes in your fluid status by weighing yourself daily and checking for swelling. Schedule regular doctor appointments. During follow-up visits, your doctors will make sure you are staying healthy and that your heart failure is not getting worse. Your doctor will ask to review your weight record and list of medications. If you have questions, write them down and bring them to your appointment. Call your doctor if you have urgent questions. Notify all your doctors about your heart failure, medications, and any restrictions. Also, check with your heart doctor about any new medications prescribed by another doctor. Keep good records and bring them with you to each doctor visit. Prevent further heart damage. To help prevent further heart damage, stop smoking or chewing tobacco. Reach and maintain your healthy weight. Control high blood pressure, cholesterol levels, and diabetes. Exercise regularly. Do not drink alcohol. Avoid if I have heart failure. Several different types of medications are best avoided in those with heart failure. These include most calcium channel blockers if you have systolic heart failure, some nutritional supplements and growth hormone therapies, antacids that contain sodium, decongestants such as Sudafed. If you are taking any of these drugs, discuss them with your doctor. It is important to know the names of your medications, what they are used for, and how often and at what times you take them. Keep a list of your medications and bring them with you to each of your doctor visits. Never stop taking your medications without discussing it with your doctor. Even if you have no symptoms, your medications help your heart pump more effectively. My quality of life. Eat a healthy diet. Limit your consumption of sodium, salt, to less than 2,000 milligrams each day. Eat foods high in fiber and potassium. Limit foods high in saturated fat, cholesterol, and sugar. Reduce total daily intake of calories to lose weight if necessary. Exercise regularly. A regular cardiovascular exercise program, prescribed by your doctor, will improve symptoms and strength and make you feel better. It may also decrease heart failure progression. Don't overdo it. Plan your activities and include rest periods during the day. Prevent respiratory infections. Ask your doctor about flu and pneumonia vaccines. Take your medications as prescribed. Do not stop taking them without first contacting your doctor. Get emotional or psychological support if needed. Heart failure can be difficult for your whole family. If you have questions, ask your doctor or nurse. If you need emotional support, social workers, psychologists, clergy, and heart failure support groups are a phone call away. Ask your doctor or nurse to point you in the right direction. Heart failure treatment is a team effort. Heart failure management is a team effort, and you are the key player on the team. Your heart doctor will prescribe your medications and manage other medical problems. Other team members, including nurses, dietitians, pharmacists, exercise specialists, and social workers, will help you achieve success. But it is up to you to take your medications, make dietary changes, live a healthy lifestyle, keep your follow-up appointments, and be an active member of the team. The outlook for people with heart failure. Your prognosis or outlook for the future will depend on how well your heart muscle is functioning, your symptoms, and how well you respond to and follow your treatment plan. With the right care, heart failure will not stop you from doing the things you enjoy. Everyone with a long-term illness, such as heart failure, should discuss their desires for extended medical care with their doctor and family. An advance directive or living will is one way to let everyone know your wishes. A living will expresses your desires about the use of medical treatments to prolong your life. This document is prepared while you are fully competent in case you are unable to make these decisions at a later time. Treating heart failure. Importance of treatment. The common symptoms of heart failure, such as breathlessness, swelling, edema, and fatigue, can make it difficult to live a normal life. Most people have symptoms that can be controlled with medical treatment for long periods of time. Others have severe symptoms that may require surgery or even a heart transplant. Heart failure is a life-threatening condition and can lead to sudden death, so it is important that you get the right treatment. Effective treatment for heart failure has the following benefits. It can help make the heart stronger. It should improve symptoms. It reduces the risk of a flare-up or worsening of symptoms. It should allow you to live a longer and fuller life. The National Institute for Health and Care Excellence, NICE, has published guidance about chronic heart failure, PDF, 468 kilobits, which provides information and advice about care and treatment. Finding the right treatments. For most people, heart failure is a long-term condition that cannot be cured. However, in cases where there is a specific cause of heart failure, such as damaged valves, surgery may be possible to replace the valves. People with an abnormal heart rhythm may be able to have treatment, such as a pacemaker, to correct the problem. In most cases of heart failure, the aim is to find a combination of treatments involving lifestyle changes, medicines, devices, or surgery that will help the heart pump properly. Treatment will usually need to continue for the rest of your life. You and your doctor will need to work together to find a balance of effective treatments that you can manage in the long term so you have the best quality of life possible.